The following video outlines the key points in the SOP for proning an intubated patient and is a visual aid to the proning SOP to be found on the Box app. Personnel must don full PPE for proning, comprising FFP3 mask, surgical hat and gown, visor, 2 layers of gloves, and IT have found it beneficial if the top layer of gloves is long, an apron, and consider the use of overshoes. The SOP includes a checklist for pre, during, and post-procedure checks. Before the procedure, the team must ensure that the consultant or nurse in charge is aware that the patient is to be proned, that the team are in full PPE and that there are no contraindications. Reintubation kit must be available outside the room and the tube position and rescue airway plan discussed. The personnel in this video are not wearing PPE for the purposes of conserving kit. Check your equipment as per the SOP.
So equipment ready, head gel pad, eye lubricant and tape.
It's been done already.
So, yeah,
Already done that and guys are already taped.
Yeah. 5 pillows.
Yes.
2 slide sheets.
Yeah.
Blue clamps.
Yes.
Proceed with the pre-procedure checks. Ensure the eye care is performed, tube is secure and the ventilator connections are taped. Stop the NG feed and aspirate the tube. Discontinue non-essential monitoring and non-essential infusions. Attend to chest drains, pressure areas, and perform mouth care. Once the pre-procedure checks are complete, move on to the timeout. Brief the team and assign roles.
So verbal confirmation between team members before the start of the procedure.
So Nuala's just going to do us a very quick verbal run through of what we're going to do during this manoeuvre. Okay. Is everyone?
The verbal run-through will help everybody understand their roles and how the procedure is performed. Once this is done, proceed with the rest of the timeout.
Have we got appropriate ventilator settings and pre-oxygenation?
We're on 100% already, and yeah, it's all fine.
Cardiovascular stability check. Stable. Adequate sedation.
Yeah, so he's on a propofol infusion at 20 mils an hour, he's on fentanyl at 3 mils an hour, and I've given him 100 milligrams of prochlorine about 10 minutes ago.
So that's for muscle relaxation. So ECG dots on the back and off monitoring.
Yeah, so we've attached the ECG dots just on the back, and we're going to take off the front ECG and disconnect the arm.
The process of proning involves enfolding the patient within 2 sheets and 2 sliding sheets and enclosing them within this by rolling the loose edges together, the so-called Cornish Pasty.
The slight tilt so you're ready and you're accountable.
So this one's just standard putting the slide sheet under the patient, isn't it?
Yeah.
So on 3, 1, 2, 3. And then a slight tilt just to great.
Whatever, and then 2 pillows positioned, 3 at the chest and 2 to 3 pillows at the knees.
I think because these pillows are quite good, we probably just need 2 and 1, you think?
Yeah, probably.
Slightly.
Okay, so we've got like a pillow somewhere, a sheet on the heart, sliding sheet right on the outside, so he's wrapped in there. So, yeah.
Tuck arm under buttock on the side the patient is to be turned towards.
You happy to do that?
Yeah. Okay. Clean sheet over patient rolled up with bottom sheet. Cornish Pasty. Okay.
The team leader will instruct the team in proning. The patient is rolled to 90 degrees with a pause to swap arms, and then the rotation continues to prone.
On 3, 1, 2, 3. Then turn to 90 degrees. 1, 2, 3.
Safety pause.
And then change in arm positions for everybody. So just swap your arm positions. My infusion's over like this. Okay. And now we'll prone on 3. 1, 2, 3.
Okay, continue to post-procedure checks.
Team then continues with the post-procedure checks, including monitoring, ventilation, and hemodynamic stability. Once the patient is proned and centered in the bed, the head is positioned in a head ring and one shoulder slowly rotated through the swimming position. The end position should be the head facing the arm that is elevated, the so-called talk to the hand position. The pressure areas are checked and NG tube position confirmed so that feeding can recommence.